About the risks the coronavirus poses to pregnancy. Not only are pregnant women more likely to experience severe symptoms, they're also more likely to give birth prematurely. 8 on your set investigator Victoria Price pouring through those studies today. She joins us live in studio.
And Keith, while the increased risk isn't overwhelmingly greater, doctors, they're still warning pregnant women to be cautious, especially with an imminent second wave of infections looming overhead.
You want to say hi? Say hi. Say hi.
With a 1-year-old and one on the way, Alexandria Stein thought she knew what to expect while expecting, that is, until the pandemic hit.
There's a lot of uncertainties, which I think is the hardest part.
But researchers are becoming more certain about how the coronavirus affects pregnant women. The CDC publishing 2 studies late last week that found those who contract the virus are more likely to become seriously ill and give birth prematurely. Only 4 out of every 1,000 women with COVID-19 will need intensive care. But researchers found that figure nearly triples for pregnant women, possibly because they're already experiencing increased heart rate and decreased lung capacity. The virus also increases the risk of premature birth by roughly 3%.
We have been expecting to see something like this. We know that these types of viruses can affect a pregnancy.
Dr. Sarah Obachon, an OBGYN with Tampa General Hospital and USF Health, says the studies reinforce what she's told patients all along. Mask up, avoid large crowds, and keep your social circle small.
The numbers aren't by percentage points very high, but when you look at thousands of women, it's a big impact.
Babies are also being born with COVID-19, most mild or even asymptomatic. But doctors say it's too soon to know how it may affect them in the long run. Meanwhile, 8 months pregnant with enough to worry about as it is. Alexandria Stein says her due date can't get here soon enough.
Needless to say, I'm sure you were just very anxious to have this baby and to finally be done with this pandemic.
Absolutely. Yep.
Now, the majority of the women in both of these studies, they were in their 3rd trimester, so that means that there's still a lot of research yet to be done about the impacts on early pregnancy.
I had to smile when I saw the little baby on the screen of the Zoom
So
call.
cute.
You can't look away from the baby. Did these studies look into how many women were actually getting pregnant and having babies right now? More, fewer?
So they didn't, but that was one thing that I did ask Dr. Obachon about, because I was curious, are people reluctant considering that we're in a health crisis, or kind of going back to the joke, early quarantine?
Pandemic babies, quarantine babies.
You know, baby boom, exactly, if we're seeing that. And she said it's still too soon to say. However, their practice, they're pretty much seeing the same numbers they saw this time last year.
Right on pace. All right.
All right. Thank you, Victoria.